Cool down, the nighttime temperatures can be especially dangerous for the homeless, and for those who already have serious health problems, it can be deadly.
So instead of waiting for a health problem to show up at the hospital, the UNM street medicine team meets our homeless where they are, and that's under bridges or on the streets.
Our partners over at UNM Health explain how this team is making a big difference in our community in this week's Healthy Living segment.
Driving around Albuquerque and probably many of the larger cities, we see our unsheltered neighbors. We see more folks living on the streets, maybe struggling with substance use disorder, mental health.
If somebody is experiencing psychotic symptoms that make it so that they aren't aware of the risk of the medical situation, or that they aren't able to have an organized conversation about getting the care they need.
I know, you're having a hard time.
We can't just do one or the other. We really need to approach both the medical and the psychiatric at the same time.
The call yesterday came out from APD. This was a patient who, back in November, almost died from exposure from the cold. And the result of that exposure left him critically ill and very medically fragile.
Where'd you sleep last night, sweetie?
Outside on the corner.
Probably cold, huh?
Yeah.
I'd like you to go to the hospital pretty soon this morning.
When was the last time you talked with your dad?
I'm in the hospital.
Was he worried about you?
Yeah.
Let's get you a cup of coffee and hang out right here, and we're going to get your friend one too.
We've all been super worried about him, and we need to get him back to the hospital so he can get the help he needs. And thank you. This coffee hopefully will help him get the courage and convince him to go back to the hospital. We're going to get you kind of cleaned up, and we're going to take you up to UNM. Working with psychiatry and APD and ACS, we're able to utilize all of our skill sets to get this patient to go back to the hospital so he can get the care that he needs.
Joining us now, Lindsay Fox, a physician assistant who leads the street medicine team for the UNM School of Medicine. She's been bringing some much needed medical care to Albuquerque's homeless community dating back to 2021. So Lindsay, why is it so important to provide not just the medical care, but the mental health aid to people who are struggling?
It's so important to recognize the whole patient, you know, that people don't exist just in silos, that they have medical needs and behavioral health needs, and you can't treat one without the other. And if the goal is to try to get people successfully housed, you know, change some real dire living situations, we have to address both. And that's why our teams are both staffed with psychiatrists, community health workers, medical providers, so we can really provide holistic health to the individual.
It might seem on the surface like you're just helping, you know, one or two people at a time, but by helping them, you're in a way helping all of us. Can you explain how this is really beneficial to everyone in our community?
That's a great question, and it's a really important observation. When we take care of those who struggle the most, we are actually showing empathy and compassion, and we can care for everyone else in the entire community. I think that it's really important to continue to be kind, reach out to other folks, and remember that all people struggle. And by meeting people on the street, we're actually bringing care to them, because sometimes medical systems can be overwhelming, complex, and we're really trying to get them the care they need right there, right then.
We saw in that story sometimes people might be a little hesitant to go. Sometimes it takes a cup of coffee. What happens if someone just says that they're just too concerned about going to the hospital? They had a bad experience maybe before.
You know, we don't give up.
Yeah.
We keep coming around. One of the important things about street medicine and the people that we work with is that they become, we go around and we regularly see them and check on them. And we hope that one interaction or one diagnosis they may consider. And once we can get them back to the hospital, they recognize just how important the care is and can be really transformative. So we just keep at it.
Yeah.
As long as they're out there, we will continue to engage with them and try to provide humane care with dignity and compassion.
Well, you're doing some great work. It's something that
you.
is very much needed in our community, so keep up the good work.
Thank you. Appreciate
Thank you for your time.
All right.